How did you react mentally to getting these news? And did your doctor actually fill you on what this disease is and what that means for you, for your life, for the future?
As best as I can remember, it's been a little while, but no, I had never even heard those words before. I didn't know anything about inflammatory bowel disease. I remember just feeling a little lost, right? I'd been experiencing these symptoms. So much of my life had changed, right? New marriage, new baby, all of these things. Was it connected to my pregnancy? I didn't know if that was something to do with it. And I didn't know anything. No, I don't feel like my physician really gave me a good understanding of what it was, what to expect, what this meant for my future. And it was a lot of like asking a lot of questions during follow-up appointments, trying to piece it together to figure out what it really meant over time.
So, how did you then navigate life after diagnosis, both physically and mentally, and maybe also take us through the different treatments that that your doctor put you on to manage or try to manage your colitis?
Right. We started with Azicol, so mesalamine at the very beginning. I physically and mentally, I cried a lot. It was overwhelming, and there were a whirlwind of emotions over the first couple of years throughout the whole thing, really. I think there was a lot of fear of the unknown. And I I hoped that, yeah, okay, well, I'm going to take this medication and the medication is going to help, and that's just what I'm going to have to do. And so that was the first approach, was kind of trusting the doctors to give me the answers because I didn't know. And so then I was taking the Azicol, and then that wasn't enough. Symptoms would keep coming. So then we'd have to increase the dosage and increase the dosage. And that was a struggle for me, to just continuing to put more and more and more medication in my body, and it wasn't quite working. That was really hard to wrap my head around. How do I trust that this is what I'm going to be relying on, but then it's not working? And so wrapping your head around those failed medications kind of, it doesn't make me not trust the physician, but the process. I wasn't trusting the process of how am I supposed to heal. I have been on so many different medications. I'm probably forgetting some, but all the different versions of mesalamine, all of the Symphony and Humira and Entyvio, and I'm on Xeljanz now with combination therapy with Apriso, which is a version of mesalamine. And I know I've done plenty other multiple rounds of prednisone, steroids, used Ceris when I didn't want to take prednisone. And I'm sure there's more that I am forgetting. But it has been a constant roller coaster of failed medication and increasing the dosage until you max out at that dose. And then you have to start over with something new. And all the time that it takes to even see if that medication's going to work in the first place. It's rough.